Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. And I'm joined by Dr. Lawrence Lowe, the Region Appeals Medical Officer of Health, and by our Director of Bylaw Enforcement and Commissioner of Legislative Services, Paul Morrison. Before we begin, I just want to acknowledge that today the city recognizes Pink Shirt Day, and that's why I've got my pink blazer on. A day that aims to raise awareness of anti-bullying in the workplace, online, schools, and homes. And I know all members of our council today at our city council meeting, which will begin at 9:30, will be wearing pink as well. The COVID-19 pandemic has affected all of us, and I'm truly inspired by Brampton's ability to support each other as we continue to fight through this adversity, and in the midst of it, demonstrate kindness, empathy, and compassion. And I just want to acknowledge that it's so impressive to see that character in our community. I want to start off by mentioning the stay-at-home order, which, as we know, has continued until March 8th in Peel Region. I want to highlight that I understand how difficult this is for small businesses, and we all need to do whatever we can to support them during this very difficult stretch. Very shortly, the Medical Officer of Health, myself, and the Minister of Small Businesses, Prabh Sarkaria, will be having a round table with small businesses to look at ways in which we can be supportive during this final period of sacrifice that we're trying to get through to keep COVID transmission down. I also want to acknowledge that I have heard concerns about region hopping, people leaving Peel Region to go to other regions, and particularly in relation to outdoor amenities. I've heard stories of people going to Collingwood for skiing or going for outdoor skating for hockey in Vaughan, and I want to acknowledge that we've heard that concern. We do want to limit region hopping. The GTHA mayors on Monday advocated that to the province, that we should lift the outdoor restrictions. And I know Dr. Lawrence Lowe last week also communicated that to the province. The public health advice is that outdoor activities are very low risk, and if it can diminish region hopping, there's no reason we can't have our outdoor amenities open. I also wanted to reference today the vaccine rollout. I'm pleased to share this morning the City of Brampton is supporting our partners at Peel Public Health in our shared fight against COVID-19, and we are absolutely ready to go with vaccination efforts as soon as the vaccines arrive. While we are finalizing the details, I can share with you that in addition to the existing Brampton vaccination site at 10 Peel Centre Drive, in the coming days, the Chris Gibson Recreation Centre at 125 McLaughlin Road North will be used as a mass vaccination clinic. And the Save Max Sports Centre, formerly known as the Brampton Soccer Centre, will be an additional vaccination clinic at 1495 Sandalwood Parkway. And this is really going to give us the capacity, once vaccines arrive, that we can vaccinate the public in large numbers. So initially, based on the vaccines we anticipate, these facilities, there's going to be 7 vaccination centers throughout Peel Region. They'll be able to vaccinate 20,000 residents a day. And as vaccines increase, we may be able to get that up to 40,000 vaccinations a day. So we're ready to go. The infrastructure is set. The sites are selected. We're just waiting for vaccines. There'll be no local delay in making sure that we can vaccinate those who are most vulnerable in our community as soon as those vaccines are delivered to the provinces from the federal procurement. I would also like to highlight, as we wait for these vaccines to arrive, we do need everyone to continue to be careful and stay at home. And if you're feeling unwell, we have additional testing capacity. I just want to reference that. In Brampton, if you're feeling unwell, it's safer to get tested. It's safer to make sure you don't pass on potentially COVID-19 to loved ones. And so you can get tested right now at the Brampton Lawn Bowling Facility, at the Flower City Community Campus, the Ebenezer Community Hall, Embassy Grand COVID-19 testing site, the Queen Square COVID-19 Cold and Flu Clinic at Snell Grove Community Center, the Professors Lake Recreation Center, and the My Health COVID-19 community testing at 2260 Boulevard Drive East. So we've got lots of testing capacity right now. If you have any symptoms, please get tested. individuals who have even moderate or mild flu-like symptoms, it's better to be safe and know that these testing centers are open for that purpose. I also wanted to share a bylaw update today, and we continue to see high compliance by the public in terms of the provincial emergency orders. There was only 3 charges under the Reopening Act in the last week, one of our lowest numbers during the entirety of this pandemic. It's encouraging to see that compliance. It speaks to the fact that the public recognizes that we have to sacrifice to get through this, that we have to listen to the public health advice. And lastly, I wanted to share an Osler update. Dr. Naveed Mohammed and his team at Osler Health continued to do a tremendous job on the front lines of this pandemic. Osler continues to be a leader in administering tests, having performed 363,277 COVID-19 tests across their sites. In terms of Osler's current capacity, there are 19 COVID-19 inpatients at Brampton Civic Hospital, 2 which are in ICU, and a further 18 COVID-19 suspects patients awaiting test results. So the hospital capacity is getting better, so that's encouraging. So today, there's reason for optimism. You know, our vaccine administration capacity is ready to go. Our testing capacity is at an all-time high, and the hospital capacity is getting better. And so, we have clear skies on the horizon. We just need to push through this last difficult period. And now I'm going to ask Dr. Lawrence Loh to share his update from Public Health.
Thank you, Mr. Mayor, and good morning. This week, Brampton's test positivity is sitting at 7.4%, which is flat from 7.7% last week, with the weekly incidence rate at 114.9 new cases per 100,000, which is slightly down from 137.2 per 100,000 last week. I welcome the provincial government's extension of the stay-at-home order in Peel through March 8th, and I also want to acknowledge Mayor Brown's leadership in hearing and acknowledging my rationale behind supporting this difficult decision. I want to be clear that this is the right call, though I know that it was hard to hear for some who were hopeful that measures might be loosened somewhat. Yesterday, the United States marked a grim milestone. 500,000, 1 in 660 Americans have died from COVID-19, and 3 million Americans, 1 in 125, are anticipated to experience chronic effects of COVID-19 in their coming years and possibly throughout their lifetime. This level of loss is unthinkable. And beyond the human toll borne by families, interestingly, a friend of mine in New York, who I chatted with last week, explained that the extent of this loss also represents America's biggest challenge to longer-term economic recovery. 500,000 lives and their associated labor, ingenuity, and consumption gone forever. Our thoughts lie with those who have loved ones or who have faced the ravages of this disease here in Peel and throughout the world, and we are confronted with a poignant reminder that there is truly no economy without health. Having said that, I know it has been a very difficult year filled with sacrifices, and the 2-week delay in returning to the provincial response framework supports our efforts to forestall a third wave and lockdown in our community. We know that vaccines and spring are drawing near. There is hope for optimism, and I do want to highlight my thanks as well to the City of Brampton for their collaboration in working on the mass vaccination sites that Mayor Brown announced this morning. With more variants being detected, however, we know that opening too quickly, only to shut down again, risks so much: the lives of our most vulnerable, the well-being of our frontline workers and healthcare providers, our recent return to in-person learning, and the viability of many of our businesses. We cannot afford a third wave and lockdown, and we must still continue to save lives amid a disaster that is seemingly like any other, but is ultimately one with unique features in timescale and response. Unlike a hurricane blowing through quickly, person-to-person spread means that COVID-19 is still a novel threat in the absence of broader community immunity. That means it takes all of us still to keep each other, especially our most vulnerable, safe from infection. The United States' experience reinforces how failing to control the virus results in the same impacts to well-being in the economy, the same loss in consumer confidence, and the same impacts to bottom lines, all atop an unthinkable loss of life. That means that the root cause of our misery is not the measures, but the disaster itself. The measures are our attempt to respond. And as with any disaster, the pain of closures is ultimately temporary and could be relieved through generosity in disaster relief. But it is impossible to recoup lives and livelihoods that have been lost or permanently changed. There really is no economy without health. I am hopeful that the extended shutdown in Peel will see success in this ongoing race against variants and vaccines, and I'm hopeful that trends will lie positively in our reassessment in 2 weeks. Crucially, however, the keys to success against this disaster remain the same. We need protections for our essential workers, like paid sick days. We need more support for impacted businesses that continue to sacrifice to keep our community safe. And we all need to do our part to limit contacts by staying at home as much as possible and only going out for essential reasons with precautions in place until vaccines come in greater availability. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, for that update. We now have some time for some questions. First up is Irene from 680 News.
Good morning. This is for Dr. Lowe. I wanted to talk about variants. Last week we heard that there were hundreds to be confirmed. Yesterday, with the provincial numbers, we had 390 confirmed cases of the UK variant. A week before, 309. So 81 cases confirmed in a week. Is it that there is a delay in getting confirmation, or are there some variants that aren't as dangerous, say as the UK one or the South African one?
Thanks, Irene. All the numbers are of variants of concern. So certainly the B117 originally detected in the UK and the B1351 in South Africa. So anything that is screened positive are for those variants. There is a delay. It appears, at least from my perspective. I certainly would pose the question to our provincial laboratory partners. Last week we had 200 that were screened positive waiting to be confirmed. As of today, we have 400 that are screened positive waiting to confirm, and we have seen our number go up from 50 to 60 confirmed. We also know, I believe, Toronto is seeing similar numbers in terms of screened positives. So I can imagine there appears to be increasing numbers on the screen positive and not necessarily a translation into confirmations in the same number at this time. So there certainly is something in the process there. Thanks for the question.
My follow-up is for Dr. Lowe as well. So come March the 9th, I would imagine residents are wondering, do you think the lockdown will end, and do you anticipate Peel moving into gray or into red?
Again, Irene, as I mentioned in my remarks, I am hopeful that our trends will remain favorable. We just needed the additional time to see the impact of school reopening. We also needed the additional time just to make sure that the signal seen with variants is something that we can either control or where that's going. So again, it will really depend on all of our overall trends, as well as our hospital capacity and our public health and testing capacity as well. Thanks so much.
Our next up is Graham from the Brampton Guardian.
Morning, guys. I'm not sure who this question would best answer this question, but at the outset of the when the vaccinations were announced, the province had promised that hardest hit areas like Peel Region would be first in line for vaccines. Has that been the case? Or has Peel been prioritized as a hotspot?
So initially, when it came to the rollout for healthcare workers, the hard-hit areas got first access to vaccines. It remains unclear what's going to happen when it comes to the general public. We haven't got the same assurances when it comes to the rollout of vaccines for the general public, and I'll use this as an opportunity to say that strategically it would make sense for that to be the case. We know that the virus has been more evident in hotspots like Toronto and Peel, and the notion that the vaccines would be rolled out elsewhere where there's less risk of spread, I don't believe would be in the strategic best interest of the province. And so focus where you've got the greatest challenge, and hopefully we're going to be in a position very soon where Canada's procured enough vaccines that we can roll them out in large numbers everywhere. But I do think there needs to be heightened attention to the hot zones, and if Dr. Lowe wants to speak to that as well.
Yeah, thanks very much, Mayor Brown. Thanks, Graham. Certainly in the initial phase of the rollout, Peel Public Health received additional allocations for our long-term care homes and high-risk retirement homes. That was why we were put on a different schedule to make sure that we got all of our long-term care homes a first dose by mid-Jan as opposed to early Feb, like the rest of the province. I would echo to some extent what Mayor Brown has said. To some extent, if you fix the problem here in Peel and the Greater Toronto Area, you're ultimately also protecting other parts of Ontario from spillover and spread. But certainly recognize our provincial partners have to balance many other considerations and many different community contexts in the course of their deliberations. Thanks for the question.
My follow-up would be for Dr. Lowe. Now, you mentioned there that I guess that's 3 weeks in a row now where the test positivity has been flat. If it's sitting at 7.4%, I think that's more than twice what the WHO recommendation is. If we're still sitting at that area come March 8th, what does that mean? I mean, are we safe to open, or is that going to be a possibility for an extension if those numbers don't come down?
Well, on the test positivity, Graham, it's one of many metrics, as you know, in terms of, besides other ones like hospital capacity, the overall case trends, the variants, which are now a factor, and also the availability of vaccines are another factor that are going to come into any decision. We're trying to figure it all out, but certainly test positivity will be one of the numbers that will be used to formulate our recommendations in the weeks to come. Thanks for the question.
And Graham, just to follow up a little bit on that question, there are reasons for optimism where there was less so at the beginning of the lockdown. The fact that the hospital capacity is much better. If you look at the Osler's numbers today compared to 2 months ago, there's a very stark difference. And we're also in a much better position that our most vulnerable residents in long-term care are going to have that vaccine protection, which can turn a deadly virus into what feels like a bad cold. So there are reasons for optimism, and now we're going to be beginning vaccinating those over 80, another vulnerable segment of our population. So I think each week that goes by, right now, it appears like we're getting in a better position. So I'm optimistic leading up to March 8th, and hopefully these optimistic signs will continue. Our next question is Denise from Canadian Press.
Hi, thank you for taking my question. My first question is for Mayor Brown. You were quoted in a Mississauga article mentioning that you want to reopen before March 9th. I'm wondering if you can elaborate on that.
Yeah, so that article referenced that we should be looking at the data on a weekly basis, something that I know the province and Dr. Lowe have committed to. There is a practice where the data is examined every week, and so we felt, and the mayors in Peel had this conversation with the medical officer of health, and we relayed this to the provincial health table, that the numbers should be looked at on a week-to-week basis, and if the variants aren't spreading at the same pace that was anticipated, if the school response is positive in terms of not spreading amongst students, those are those are reasons that it could be revisited. And so I know sometimes we set out a sort of cookie-cutter timetables where it's 2 weeks or 4 weeks for a lockdown, and I think it's in everyone's best interest to be constantly looking at the data.
Thank you, Mayor Brown. And my second question is for Dr. Lowe. Dr. Lowe, what can you say about reports of Peel Police just letting people walk out of Pearson Airport, just taking the fine for breaking quarantine rather than paying for hotel rooms?
So, yeah, Denise, I can't comment on Peel Police matters, and certainly you should chat with Chief Nishturiappa around his perspective on that matter. But I think just generally, my perspective as a public health officer is, we have asked throughout this pandemic for people not to travel for non-essential reasons. The federal government has now put in place quarantine measures that are designed to protect our community. It's unfortunate that what you're describing might be occurring, and I think to the extent that I would really encourage people, remember, as I said, it's a disease that spreads from person to person. It takes all of us to do our part. Thanks so much.
And Roberta, if I just add to that, frankly, I think it's selfish for those who choose to go on travel right now, international travel, and then ignore the responsibilities of quarantining to protect others. If you look at the tragedy that happened at Roberta Place in Simcoe County, it was because of travel-related exposure of a UK variant. And so by not being mindful that you can bring dangerous variants into the country, you're being selfish to your neighbors, to your city, and I hope that people do abide by the new stricter guidelines when it comes to your responsibilities if you choose to go on international travel at this point. Richard from the Toronto Star.
Hi, this is a question for Dr. Lowe. Dr. Lowe, I'm wondering if 6-7 weeks into Toronto's decision to name businesses with outbreaks, you've seen anything that's changed your view of whether Peel should be naming all workplaces with outbreaks?
Yeah, so Richard, I want to start by saying that we work very closely with Toronto Public Health and respect divergences in our practice. And I also want to reiterate that Peel Public Health's policy actually aligns with the majority of public health agencies in Ontario and Canada and the Western world, where workplaces in outbreak are always disclosed if there is a risk to health of the public identified through investigation. Peel has so many workplaces that are not open to the public, and so what we often find is that public exposures have not occurred, which is why that policy is in place. So where there isn't a risk to the public, my mind goes to what will keep impacted workers safest. And our policy has been shown to foster cooperation with employers. It allows our investigators to get in more quickly, to stop spread, to act sooner, to save lives, and while also protecting the public if a public risk has been identified. Now, naming workplaces after an outbreak has happened also doesn't necessarily do anything to protect those workers and may even impede it. We have actually seen how certain workplaces will refuse to cooperate with us or will actually even illegally let go of their workers just so that they're not associated with the workplace. So that's why we brought in our Section 22 in November to require workplace cooperation, and we have seen much cooperation since without needing to move to public disclosure. So I think the other thing I would highlight as well, Richard, while I'm just briefly on this topic, one of the things that I hear is that people want to know the names so that they can advocate. And I would highlight that we were and continue to be one of the first health units in the province to release info on every sector, every outbreak by sector, and also in summary. And I actually read a Toronto Star article just recently which named 4 food processing plants and identified a lack of paid sick leave as an issue at 2 of them. I fail to see how that message is different from what I've been delivering since November. I think I've been very clear about those pieces. So, I think what we're seeing to some extent is a clash between public health practice and journalistic tradition. For example, we also declined to name the condominium cluster that we did testing at just last week, but the media still went ahead and published the address, and that's actually someone's home. That's actually a very identifying detail for people who might know someone who's diseased. So, there are people now that have been outed because that as potentially having 1351 variant because of the media's decision to publish that condo address, and I really would question if that's what we want. Thanks.
Sure, I'll just give you a follow-up, which is, I'll give you a specific example from Toronto, which the Star, one of my colleagues, reported, which was that a CIBC call center had an outbreak, and the only reason the public now knows that CIBC is not having all its call center employees work from home, which is very possible, is because this was published. So without that disclosure, we don't know, and the public can't then put pressure on workplaces that may not be doing best practices. And you've answered it, but I want to give you. I just want to make sure you've had a chance to answer that specifically, which is, we're in an atmosphere now where workplace inspectors are overloaded. there are an incredible number of workplaces in Peel. Why not add the public disclosure to that to make sure we really know when and if workplaces aren't cooperating or aren't or having these issues?
You know, Richard, I think I already answered that question. I think to the extent that you're going to potentially stigmatize people who may have actually done everything right as well, that is another concern. And I think to the extent that I've made it very clear, our focus is on how do we get in quickly and protect workers and keep them safe. And we have yet to be confused. But what I can share is that I have written a letter to the Chief Medical Officer of Health to asking them and the Public Health Measures Table to provide their insight in respect of public disclosure as a public health measure. Thanks.
Okay, thank you. Next question is for Nitin Chopra.
Good morning. My first question is for Mayor Brown. Mayor, as you were asking for the paid sick leave, but other side, the province, the Premier Fourth category announced many times that it's already given by the federal and they don't want to do a double dip. So don't you believe that it will be a huge burden on the employers also, and many businesses are struggling for survival and facing manpower shortage too?
I think it's critical that that we get through this lockdown with COVID-19, and paid sick days will help us slow the spread. Paid sick days will allow businesses to stay open. You know, getting through COVID is critical, and right now I think there is a significant misunderstanding between the provincial and federal governments in terms of how the paid sick programs are working. The provincial government says it's the federal responsibility. The federal government says it's provincial responsibility. And let me say what is flawed. The Canadian Recovery Sickness Benefit takes months to arrive, sometimes up to 3 months, and it's below minimum wage. And so for those who think that is a solution, for someone working in an essential workplace who's living paycheck to paycheck, for them it's a choice of going to work or putting food on the table. It's a choice of being able to pay their rent or go to work. And so we have to understand the precarious positions that many of our essential workers are in. And it's easy to criticize paid sick days from the comfort of a public sector job where many people are working from home. Understand the sacrifice that these frontline workers have taken on, and then look at the data, because the data is the most persuasive argument in favor of paid sick days. The data from Peel Public Health showed that between August in that 6-month period to more recently, 20% of the cases through contact tracing, 20% of the cases involve people who went to work sick, who went to work positive with COVID-19. We need to make sure that no one is in a position where they feel they have to go to work sick, because that leads to workplace outbreaks. Workplace outbreaks leads to community spread. Community spread leads to our most vulnerable ending up in the hospital. And so this is a tool that works. This is a tool that we need, and I'm going to continue to be part of the strong push, the voices pushing for paid sick days.
Thank you, Mayor. My follow-up is, anyone can answer, either Paul Morrison or Mayor. There was a confusion for the $2,000 for the traveler per must hotel quarantine. Is that some hotels are charging $300 per day, that becomes $1,000 for 3 days. So is there any clarity that either passengers have to return the money from $2,000, or is that the cost is less? Because there is very confusion among the travelers too.
So Nitin, that's a question you'd have to ask the federal MPs. This is the federal program. It's a program that I think is important. It's a program I think is in the best interest of public health, but it is a federal program. From my understanding is if you spend the full 14 days, it's $2,000, but if it's a shorter stay and you test negative, that the cost is diminished. So we have time for one more question because council is about to start. Manan Gupta from Road Today will be our last question.
Thank you very much, Mayor Brown, for hosting this conference. My question is for Dr. Lawrence Lowe. As you know, province has, given the planning responsibility to local public health units, and considering region of Peel and Brampton is home to a vibrant trucking community who are considered essential workers, they are crisscrossing U.S.-Canada border. Is your public health unit considering, to include truck drivers in your vaccination plan as a priority?
Thanks, Manan. We continue to adhere to all aspects of the provincial prioritization framework. Truck drivers and other essential workers have been identified by the province as going in Phase 2, which is anticipated to start in April. At this time, we continue to work on our highest risk priorities, including high-risk healthcare workers, long-term care homes, high-risk retirement homes, and then certain classes of healthcare workers, including immunizers, et cetera. So thanks so much for the question.
Thank you for your time.
Okay. Thank you, Manan. Well, that completes today's COVID-19 update. I want to thank everyone for tuning in. And between now and next week, please stay safe, listen to the advice of Peel Public Health, and we look forward to talking to you again soon.